Hi guys, welcome to my YouTube channel. And today we'll be talking about inherited metabolic disorders, which are also known as leukodystrophies. It basically affects white matter in kids. Now, this is a very lengthy topic, and I personally had a lot of problem with it during my residency. So I'll just try to make it simpler for you so that it's easier to understand. And we'll just talk about the broad, big picture, and I'll try not to delve into much details. Now, so leukodystrophies are basically disorders which are affecting the white matters. Now, there are three things which can happen to the white matter. You can have dysmyelination. Now, dysmyelination is that normal white matter never forms. Then secondly, you have demyelination. Demyelination is when the normal white matter is destroyed. There is destruction of the normal white matter. And then there is hypomyelination. Hypomyelination means that the fibers, they never truly myelinate. There is decreased myelination. So you have dysmyelination, you have demyelination, and you have hypomyelination, which occurs in these disorders. Now, inherited metabolic disorders of white matter can be broadly divided into two types. One is affecting the deep white matters, and the other is the subcortical. So the disorders which are affecting the deep white matter include metachromatic leukodystrophy, and then you have adrenoleukodystrophy. And in both of these disorders, you have normal size head. And the disorders which affect the subcortical white matter include Alexander disease, and then you have Van der Naap disease. Now, Van der Naap is also known as megaloencephalic leukoencephalopathy. It's a very a lengthy word, so I just prefer Van der Naap disease, but you can also call it megaloencephalic leukoencephalopathy. And in both the diseases, you have increase in size of the head. I know my handwriting is not the best, and if I'm going a little bit slow, you can fast forward the lecture. But I want to go slowly so that you don't have trouble with any of the concepts. Now, in deep, you also have other diseases which are vanishing white matter disease. You have Krabbe's disease. Krabbe's is also known as globoid cell leukodystrophy. So there you have it. Broadly, you can categorize into two headings, which is deep white matter and subcortical white matter, and then you have 4 diseases in deep and then 2 in subcortical. Now we'll handle all of these one by one, and I hope that now, usually in conferences and in quizzes, in sort of board exams, you're usually shown ahead with a very serious involvement of the white matters in kids. So you should be always thinking about leukodystrophies as your primary differential diagnosis, because all of these are very serious disorders. They are most of them are untreatable and subsequently fatal. Now we'll take metachromatic leukodystrophy. We'll begin with that. And so metachromatic leukodystrophy, you have, like I said, the head size is normal. You have a normal head. And it usually affects the Jews and Navajo Indians. There is sparing of the U fibers initially. Now the U fibers is you have the sulcus spaces and the gyri, and this is the cortex. Now these fibers over here, this is the gray matter and this is the white matter. Now the fibers which are just beneath the gray matter cortex are the U fibers, and it usually spares these fibers and it gives it a characteristic appearance. So there is sparing of the U fibers, and there is also sparing of the cerebellum. So this is one of the characteristic points which helps in diagnosis. So we talked about sparing. Now what does it involve? It usually first involve the parieto-occipital white matter, then it goes on to the frontal lobe, then temporal lobe. So there is parieto-occipital, then you have the frontal lobe, and then you have the temporal lobe. And it spreads in a centrifugal manner, and along with parieto-occipital, it also involves the corpus callosum splenium. Now let me just show you a picture. Now this is a classic metachromatic leukodystrophy, and you can see that the white matters are involved, but it spares the U fibers which are lining the subcortical area. This is a diffusion image, and they say that all that glitters is not gold, and all that restricts is not an infarct. Now this is one of the differentials of diffusion restriction in kids, that if you have gross involvement of the white matter, you should always think about leukodystrophic disorders, especially metachromatic. Now this is giving you a slightly striated appearance. You can see some of the fibers which are not as hyperintense on T2. Now this is the classical tigroid appearance, which is often mentioned in textbooks. So you have here are the ventricles, and then you have a little bit of striations, which can be subtle at times, and this is the classical tigroid appearance, which is often mentioned in the books which you read. Now, metachromatic leukodystrophy can be of three types again. It is infantile type, which is affecting 1 to 2 year age group. Then you have the juvenile type, which often affects 5 to 7-year-old kids. And then you have adult onset. Adult onset is more than 16 years. Now it is the most common, MLD is the most common leukodystrophy. So that is often an MCQ question. And it results due to deficiency of an enzyme which is known as aryl sulfatase A. There is no enzyme aryl sulfatase A, and therefore you have buildup of these lipids in the white matter. And the treatment, which is still in infancy stages, is gene therapy. A lot of people cannot afford it, especially in third world countries, so it's often a fatal disease. There is there is very mild volume loss, hence you have the normal head, because there is very low volume loss due to the disease. And on contrast, you have no enhancement. On T1 post contrast, there is no enhancement. So that's all the imaging points. And usually people who who can't afford the gene therapy, they usually die within 4 years of the disease. And yeah, one thing I forgot to mention is that because of deficiency of this enzyme, there is a buildup of sphingolipids. And sphingolipid buildup is what causes this disease. All right, now let's look at another disease which affects the deep white matter, which is adrenoleukodystrophy. Now this is also known as Bronze-Schilder's disease. And this also, the kid in this disease also, the kid has a normal head. What happens is that age group of 5 to 10-year-olds are affected in this, and there are 3 zones of involvement in the disease pattern, and usually you have symmetric involvement of the bilateral occipital lobes and also the splenium. So the splenium of the corpus callosum and bilateral occipital lobes are involved, and there are 3 zones. The first is the zone of demyelination. The second is the zone of inflammation. Now this is on a histologic scale. And then you have the burned out region. Now the zone of inflammation, obviously there is inflammation, there is hyperemia, so this zone will show enhancement on T1 post-contrast sequences. So it has a very characteristic appearance. You can look over here that there is enhancement of this zone, and beneath this zone will be a burned out zone where the death occurs. And the inflammatory zone is where you will have restriction also. I'm not sure if I have the restriction image over here, but as you can see, there is gross edema of the occipital white matter, and also it is involving the spleen. Now, an interesting thing is that it is X-linked. It is also known as X-linked adrenoleukodystrophy. So because it's X-linked, it mainly occurs in boys because they have an XY chromosome, and there is a deficiency of the paroxysmal enzyme, and there is impaired beta oxidation of very long chain fatty acids. So this is basically the pathology behind the disease, and there is buildup of these fatty acid chains, and that's what causes the disease. Now, besides occipital lobe involvement and the splenium involvement, it can also lead to Addison's disease. And the treatment for this is Lorenzo's oil.